Prostate cancer is the second most common cancer among men in the U.S. It's important to understand the risks and when it is time for a screening. City of Hope Cancer Center has the latest treatment and care.
Medical oncologist and chief clinical officer Dr. Walter Stadler and radiation oncologist Dr. Kevin King join us now with more. Gentlemen, thank you so much for being here.
Thank you.
Our pleasure.
Dr. Stadler, how common is prostate cancer?
Well, I think as was just said, it's the second most common cancer in men, the most common in men over the age of 50. And there's about 314,000 men that are diagnosed in the U.S. every year. That's about the equivalent of 5 soldier fields fully filled. And unfortunately, there's about 36,000 deaths a year from prostate cancer.
Oh, my goodness. Is it a difficult cancer to diagnose?
Well, from a diagnosis standpoint, that's what we're really here to talk about today. Because at the end of the day, I know that most men who don't want to get, a prostate cancer screening or anything along those lines, it's because there's an uncomfortable exam that could be involved with it. But here's the thing, it's as simple as a blood test. One blood test for something called the prostate-specific antigen, or PSA, can be something that we are able to detect the cancer early and find it at a stage when it's most curable.
Okay, so let me follow that up. So if a guy's going to his annual exam, he's not necessarily always getting screened for prostate cancer, is that correct?
Oh my gosh, thank you for saying that, because no, it's not always the case. The screening guidelines right now are kind of all over the place of when and who should be screened. So it's so important to always talk to your doctor about getting screened for prostate cancer. And unfortunately, sometimes that falls on the patient to be the one to go out there and say, hey, you know what, I want to get this screening.
Yeah, and so it's something you can actually request from your doctor.
Yeah, no, you can and you should. And in fact, there's about 2/3 of men who should be getting screened that are between the ages of like 50 and 69 who simply don't get screened because either the doctor doesn't remember or the patient doesn't ask. And I think it's important to remember that certain patients are at a much higher risk of this disease.
Okay, who are those patients?
Well, so, I mean, an important group is black men. Black men are much more likely not only to get the disease, but also to die of the disease. And interestingly, it's also patients who have a family history of prostate, ovarian, or breast cancer.
Really?
Yes.
Now, for someone who's sitting at home who may not be their time for actually to have a screening or going for a doctor to visit, what are some of the symptoms that they should be aware of, that they should be thinking about?
Well, so that's the thing. Sometimes there is just urinary symptoms if they're going to the bathroom more or something along those lines. Sometimes even if they find some blood in the urine. But a lot of prostate cancer doesn't have any symptoms at all. And that's where it comes down to really making sure that you're up to date on your screenings. The American Urological Association recommends starting at age 45 for men with an average risk. Or if you have any of those increased risk factors like Dr. Stadler just said, then they recommend starting at age 40.
Okay.
Yeah, it seems like people in general are getting cancers younger and younger. And I know at least for women, they are saying you don't need it, but you could get these tests. So these things that men should be saying, I want this test?
I think so. I think the answer is, if you're, as Dr. King said, if you're at an average risk, 45, 50, you should be getting screened. If you're at one of these higher risk groups at a younger age. I think one of the things that sometimes comes up is, because this is a slowly growing disease, there are patients, especially sort of the elderly, who perhaps don't need to be screened because even if the cancer is diagnosed, it would likely not impact their life.
Oh, okay.
And I because I've had a diagnosis come up in our family, I'm surprised at the treatment. Sometimes the treatment is not as invasive as most people would think. You shook your head there.
As a radiation oncologist, I can definitely speak to that. And even sometimes, active surveillance where we just keep a close eye on it and we keep getting PSA checks and PSA screens, that is the treatment. We're going to say this cancer is so slow growing that we're just going to let it sit there and keep a close eye on you. We don't want to actually do anything right now because sometimes the side effects have such an effect on quality of life at times that it's better to just keep a close eye on it and let it ride.
So this is one of those things where you shouldn't be scared to get the test to find out a diagnosis because it may not be as earth-shattering
As you
think
think.
it's going to be.
Absolutely. I agree with that. I think that not only do we have great treatments when the disease is localized, even in patients where unfortunately the disease has spread, we're now managing these patients for years, if not for decades. And so we expect the majority of patients to live out their normal lives.
You are a recent doctor to join City of Hope. Why did you want to go to City of Hope?
Well, so it's an interesting question. I spent 30 years at the University of Chicago and have great friends and have the utmost respect for that institution. But one of the things that's happened in cancer these days is there's all these amazing advances, and yet there's so many patients who don't get to realize those advantages. And one of the things that I hope to do at City of Hope is to bring world-class cancer to patients closer to where they live.
Oh, fantastic.
amazing.
Yeah. Thank you, gentlemen. We appreciate
you
you
so
being
much.
here.
Of course.
City of Hope's downtown Chicago location is at 160 Upper East Illinois Street. For more information, give them a call or visit cityofhope.org/downtown-Chicago.